How does genetic predisposition affect colorectal cancer risk? Imagine your genes as a set of instructions that shape many parts of your health, including your risk for colorectal cancer. Some people inherit specific gene mutations that can significantly increase their chances of developing this type of cancer. These inherited mutations are responsible for about 5 to 16% of all colorectal cancer cases. This means that for some individuals, their family history and genetic makeup play a major role in their health outcomes. One of the most common inherited syndromes is Lynch syndrome, also known as hereditary non-polyposis colorectal cancer. It results from mutations in mismatch repair genes that normally fix errors in DNA during cell division. When these genes don't work properly, errors build up, leading to cancer. People with Lynch syndrome can have up to an 80% chance of developing colorectal cancer in their lifetime. They often develop cancer at a younger age than the general population, sometimes in their 30s or 40s. Another well-known inherited condition is familial adenomatous polyposis, or FAP. This syndrome is caused by mutations in the APC gene, leading to hundreds or even thousands of precancerous polyps forming in the colon and rectum, often starting in adolescence. If left untreated, nearly all individuals with classic FAP will develop colorectal cancer by age 40. There are other forms like attenuated FAP, which cause fewer polyps and later onset, and Gardner syndrome, which includes additional benign tumors. Other rare inherited syndromes also influence risk. Mutation-associated polyposis is an autosomal recessive condition, meaning a person needs two copies of the mutated gene to be at risk. Turcot syndrome combines colorectal polyps with brain tumors, and NTHL1-associated polyposis is another rare genetic condition. Most inherited syndromes are passed down in an autosomal dominant pattern, meaning each child of an affected parent has a 50% chance of inheriting the mutation. Some, like mutation-associated polyposis, follow an autosomal recessive pattern, requiring two copies of the mutated gene. Recent research suggests that inherited mutations may contribute to a larger portion of colorectal cancers than previously thought. About 1 in 6 colorectal cancer patients carries a gene mutation linked to cancer risk, even if they do not have a known family history. This highlights the importance of genetic testing and evaluation, especially for those with early onset disease or a strong family history. Knowing your family history is crucial. If relatives have had colorectal or related cancers, your risk may be higher. In such cases, doctors often recommend earlier and more frequent colonoscopies to catch any issues early. Genetic counseling can help assess your likelihood of carrying harmful mutations and guide testing decisions. For those with high-risk syndromes like FAP, preventive measures, such as surgery, might be advised to reduce cancer risk. While most colorectal cancers develop from acquired mutations influenced by lifestyle and environmental factors, inherited genetic mutations can make some people more susceptible or cause cancer to develop earlier. Understanding these genetic factors helps tailor screening and prevention strategies, offering a proactive approach to colon health. In summary, genetic predisposition influences colorectal cancer risk by passing down mutations that impair DNA repair or control cell growth. These inherited changes can lead to earlier onset and a higher chance of developing cancer. If you have concerns about your family history or genetic risk, consult with healthcare professionals who can provide personalized advice and testing options. Remember, knowing your genetic background is a powerful step toward maintaining your colon health and reducing your risk.